I'm Joan Maurer from the Office of Strategy and Development at the Broadcasting Board. And we're going to start the program off with David Enzer, who's the VOA Director. And I'm going to just turn it over to David to get things rolling. Thank you for coming again.
Again, thank you everyone for coming out today. It's great to be hosting this event here in the VOA briefing room, as we like to call it. A lot of interesting events have occurred here over the years. And this is another one that is not insignificant. It's my pleasure to welcome our distinguished panelists and guests to this timely discussion on the impact and value of communication in advancing the health of people throughout the world. We're delighted that several of the major players in the international health communication field are with us today as we gather to mark the launch of the latest edition of the Journal of Health Communications, this one. And this one focused on international perspectives. Dr. Scott Ratson was the editor, and Elizabeth Fox, sitting next to him, was the guest editor of this publication. At VOA, coverage of health plays an important part in our mission, delivering fact-based news and information. And in fact, our research has showed that international audiences consider news about health one of the most popular subjects that they want to hear more about, often just behind local news in sort of categories of importance as far as the audiences that we survey have told us. And our ongoing partnerships with USAID, with CDC, and the State Department have played an important role in our ability to cover these subjects. Since 1997, for example, USAID has supported VOA in broadcasting health news across multiple platforms to hundreds of millions, literally, of listeners. Moreover, we've engaged local communities on 5 continents on health issues. And let me just give you a few quick examples of that. In West Africa, we have run, and we are now running, an effective campaign on Ebola, sharing stories and also public service announcements with broadcasters, and we're doing this in conjunction with the British Broadcasting Corporation. So they run our pieces and we run theirs. They run our public service announcements and we run theirs. We agreed, the director of the BBC and I, that this was not an area where there was any room for competition. We wanted to be able to just do as much to maximize our effectiveness as of the 2 biggest international broadcasters in West Africa. In Nigeria, we have a popular radio program that focuses on maternal and child health, on family planning, tuberculosis, and malaria. And we mounted a huge CDC-sponsored polio awareness campaign last year. Nigeria made some significant progress against polio in 2014, officials are telling us. And right now we've got a similar polio project that's underway in Somalia. In the DRC, Burundi, Cote d'Ivoire, Tanzania, and Mozambique, we've tackled HIV/AIDS, reporting on treatment, prevention, and stigma. In Bangladesh, USAID's support has allowed us to partner with local TV and radio stations to produce shows that tackle the issue of child survival. Training journalists on best practices in health coverage is another big part of our work. And we've helped journalists understand avian influenza and other diseases across Africa, Latin America, Southeast Asia, and Eurasia. So VOA broadcasting in English and 47 vernacular languages across the globe is able to reach people with the news and information that improves their lives and saves lives, literally. We're very proud of the work. We're very proud to be partnered with our federal partners and funders in some cases. And with that, I would like to turn the panel over now, the microphone over to Ndine Nyaki, who has broad experience in covering health issues in Africa and who has agreed to moderate the panel today.
Thank you so much. Thank you so much. Thank you, and good evening, everyone. And thank you so much, Mr. Ansel, for setting the tone and the example for what good journalism should be. And absolutely, today we have a great panel of experts who are going to really try to get us to be a little bit more effective in terms of how the media, which of course I know everybody in this room agrees is a very, very critical tool in addressing many, many of the world's concerns, including, of course, health. I'm not going to give the full bios, but they are in the pamphlets and the booklets that you have, but I'll just go quickly through as I introduce the panelists. Right here on my right is Mr. Sylvia Wiseborn. He is the professor, director of graduate studies, School of Media and Public Affairs at George Washington University, and also editor-in-chief of Journal of Communication. And next to him is Elizabeth Fox, director, Office of Health, Infectious Diseases, and Nutrition at the USAID. And then further to my right is Mr. Scott Radson, who actually authored the Journal of Health Communication and also vice president of Global Corporate Affairs, Anheuser-Busch InBev. And also I'll mention that we have copies available for anyone who would want to pick some up outside as you're going out. And then to my farthest right is Ms. Dr. Marsha Vanderford, Associate Director of Communication Centers for Global Health, U.S. Centers for Disease Control. So please, let's give a round of applause to our very distinguished guests. And I want to thank everyone, just to echo what Joan said, for coming out. You know, the weather is not the best today, but you know, always the troopers will come out. So we appreciate that you did. And I also want to remind those who are not in the room, we are actually streaming live, and the hashtag is #media4health. That's the number 4. #health4media. So we're going to get started because we have a lot to talk about and a little time. And I'm just going to do what we call rapid fire, just kind of throw out the first question to all of you. And that has to do with, in your opinion, how effective media has been in covering health. I'll start off with you, Mr. Silvio.
I think that the evidence, and that's what this issue shows, that there is sort of mixed evidence about media impact, or the question about media impact on health behaviors. And I think it has to do with sort of the way we frame the question. The question is, given certain obstacles or challenges for improving health, what is it that the media and other sort of communication approaches can do to address the obstacles? So what the evidence shows, and I think the articles are very good at showing actually this, that when the obstacles are sort of information, lack of knowledge, misperception about risk, then the media can sort of contribute a great deal in promoting those kinds of changes. In other cases, where the obstacles for improving health are of a different nature, then we have to think differently about how the media can promote sort of changes in perceptions, in attitudes, stigma, or other sort of obstacles that explain why there is no improvement or sort of better conditions for health. So in summary, I think that the answer to your question is it depends. I know that it's a very ambiguous answer, but actually it depends on the kind of challenges that we're facing on the ground.
Okay. Elizabeth?
We can't use it depends. We have to be in some of our programming when people ask us that question, and we're taking a health perspective. We have to be, and this is why we've had to really look at the evidence. We had to say, you know, in certain circumstances, and I say media, but I also mean sort of bigger, broader communication through any type of interpersonal or communication channel. We have taken a really hard look at when it works and why it works and when it doesn't work, because we have to make sure that our resources are invested in the right places. So in part of it, it's the behavior. Some of the behaviors are one-off behaviors. You know, you take your kid to get vaccinated once. Some of the behaviors that are looking at changing in terms of our media are things like you've got to sleep under a bed net every single night, or you've got to do safe sex every single time, or you've got to wash your hands after whenever. So you also have to look at what are the behaviors that you're looking at. But we've looked at this in terms of, and one of the chapters in this really goes across almost 25 years of media research. I think that's what Sylvia was referring to. And says, does this stuff work? And I think we've been able to come back with the authors and say, yes, it does. There is evidence that media has an impact on health. Of course, I'm somewhat flippant and say I don't use depends, but it means you have to say when, in what context, and what's the audience.
Scott?
Well, you know, thanks to Miyake. That's a big question on does the media make a difference? Does the media impact? And my question to many of us here are, who are the media? And some places we say, who is the media, right? We think about them very differently. And I'm just trying to think back over, shall we say, the last century of what the modern mass media may have been. So in 1933, when Franklin Roosevelt would give his fireside chats, there were only about 60 million people that were listening via radio. When I was born, there were only 3 television stations. If I fast forward now, my kids, when they were born, only half the world's population had ever made a phone call. My kids were only 15 years old. Now today, we have nearly half, depending on how far you want to go, the world's population that has health within reach of a modern device. So what does that mean for all of us? At the same time, we have the media that's no longer a monolith, but we have the media that's all of us. I would venture a guess that there's more devices in this room than there are wristwatches. And amongst that, we create our own news and our own social networks. So what we've started to see is a diffusion very different than what we've seen in the past, which made it a big challenge for this issue of the Journal of Health Communication that Elizabeth and Robert Balster served as guest editors to gather the evidence and look at the whole scope of how you can impact health behaviors with media. And I think the evidence is clear that yes, you can make a difference, and I think that the evidence is clear that cannot make a difference alone. Media alone does not make a difference. You need the services, you need the politics, you need the policies, you need a willing public, you know, a variety of issues that I think VOA, Voice of America here, stands for in terms of informed public and active cooperation on the part of the public are of the utmost importance. So the short answer is there's a lot of evidence. The strong answer is that Elizabeth has mentioned the need to use the evidence to inform USAID and other global health projects. And I think thirdly, how do we use the new technologies to create a newer, if we can say, media of knowledge that increases the literacy level around the world to help make sustainable change.
Thank you. Masha.
I'm going to do a little bit of a dive into the weeds here because I'd like to ground some of this in our recent experiences of Ebola and the communication that's going on there, and where communication and the media have in some ways helped and in some ways not helped. To do that, I'd like to kind of take everybody back to September, early September, about maybe the first week, when about 150 organizations sent representatives to a communication forum on Ebola. And at that meeting, people were a swirl, right, and being overwhelmed by what was going on with, at that point, about 4,200 cases in West Africa and about 2,200 deaths. At that point, the government of Dakar, Senegal and Dakar, had just announced the first importation of a case from Guinea. The World Health Organization had a month before just declared a public health event of public health emergency of international concern. And the people gathered in this hall were representatives of newspapers, print, social media venues, radio. They were representatives of West African government. They were representative of international organizations like WHO and UNICEF. Mario Bravo was there from USAID. I was there from CDC. And the purpose of the meeting was to try to figure out from all of these organizations that were trying to communicate to citizens in West Africa how to protect their health and how to raise awareness around the world of what was going on. So the purpose was to say, we're not doing it right. What do we do to fix this? Part of the activity in this session was for journalists to sit down with humanitarian organizations and with governments and try to figure out how media could help, especially with some of the community engagement that was going on. But at the end of the 2 days, where we did lots of work group sessions and we tried to prioritize and so forth, there were lots of recommendations, many of which have gone by the wayside. But a couple of them, I think, have stood the test of the last several months, and I wanted to share those with you. The group decided as a whole, including the TV, print, media, and government groups, that communication and media could indeed help. It could save lives. It could strengthen the relief efforts that were going on, but only if the media did a couple things, and everybody in the room did a couple things. One of those things was for the media to stop talking about the West African outbreak and start talking to the West African citizens about ways they could protect their health, not to only do the first. Not to only talk about them. And the second is that new partnerships had to happen across all of these dozens of organizations who are in the field, talking to media, talking to communities, and start giving the same consistent message so that people would not be as confused. I think inherent in those recommendations was a real understanding that was in the room about what was needed in order to help protect people's health by giving them the kind of information that would encourage the perceptions that would help them and their communities to stay healthy. And I think one of the things that was shared was this understanding that in order to initiate health behaviors, to change the way people were living their lives that were putting them in danger, is first, people needed to be aware that there was a health risk, that they were, second, susceptible to that health risk, and third, that there were steps that could be taken that would protect them from that health risk, and that where those steps were hard and against cultural norms, there were resources and community support that would help them. Very, very important in the case of the protection steps that were being encouraged. Yes?
I don't mean to cut you off, but I do want to expound on your points in a few minutes, because I want to go back a little bit.
Very sorry.
No, really, thank you. Set the tone for us, because it's really in depth, obviously. There's a lot going on, and it's not just a question of one area working. I want to go back, starting with you, Scott, and obviously this particular journal addresses the issue of child survival. And from what I've read, the child survival, at least mortality rates, really dropped significantly from about 12 million between 1990 and 2012 to about 6 million, which is about half. The question, of course, is what was the key factor? How much did media play in that reduction?
Wow, that's a great question, and I'll defer to a lot of other experts I know in the room who have much longer experience than I, working both in the field and directly. You know, what I would first like to say is that clearly some of the sustainable social and behavioral change, which need to go together, are the long-standing work of setting the social norms and creating opportunities via effective communication. A lot of the child survival work, not only with oral rehydration salts and other vaccinations and other pieces that Elizabeth has mentioned, have probably been some of the largest differences that have made largest intervention that have made a difference over the last generation. But I would say fundamentally, and not only the macro evidence, shall we say, mother's education continues to translate into sustainable behavior and social change. And that is one of the areas. While this journal is not specifically looking at that, I'd like maybe Elizabeth and others who have a broad range of sight and sat on many of this. This journal is not just a publication, which I'd like to say publication lives. That there was an evidence summit that was behind this. Countless work by many people who are in this room, both at USAID, UNICEF, other governmental organizations from around the world, and academics to review the state of the knowledge and translate it into news and information that we can use. I know we'll come back to some of the other challenges that we face in both infectious disease versus non-communicable disease, but without a doubt, some of the sustainable pieces are reflected in the work that's been in communication for behavior change. And many areas that I think we are at risk today are listed here, and I'm speaking specifically about vaccination. I think we've seen vaccination and polio near eradication. We're not there yet. The last mile is farther than we like it to be, the last kilometer. And we have the threat of vaccine-preventable diseases coming back in this country, the United States, today, measles. Whether it's in Northern California, Eastern Washington State has coverage about the same as Northern Nigeria. There's some places that we really have to look at this. So I know I'm jumping around on your answer, but I really would like to defer to many people on answering that question.
Well, Elizabeth, I will come to you, and on that same point, because obviously as USAID you are involved in the issue of ending and preventing child maternal death. And when you look at the role of media in trying or whatever it has managed to do to facilitate that, how would you define it?
Good. And Rebecca, it's a really good question. You posed it in the right way because it is the goal of ending preventable, in the world, preventable child and maternal deaths. And the world has seen enormous progress, going from 12 million children a year under 5 dying to 6.3 today. One of the things that people are always asking for numbers, and numbers are really important, and especially in the government today, we've got to deal in numbers. And so when the question comes up, how much of that can you attribute to media, or to communication, or to changing norms and social norms? And it's always hard to look backwards. One of the things we did in this, partly in this, but partly in our setting the goal to end preventable child and maternal deaths in a generation by 2035 to have no preventable deaths under 5s, was looking at how much of that will be behavior. How much of that are simple behaviors like washing your hands, like getting a vaccine, or like breastfeeding, or oral rehydration. And so I've got some numbers for you, Scott. Between now and 2020, if we had hand washing with soap, that would save 1 million kids under 5. Hand washing with soap before eating at appropriate times. If we used oral rehydration therapy with kids with diarrhea, it would save 500,000 children under 5 between now and 2020. And breastfeeding, which is the most common of all behaviors, and very much linked, as you all can see, with advertisements and media, and images of body and women. If breastfeeding were the norm for children under 5, in the 24 countries where we work, it would save 250,000 kids in the next 5 years. So those are really impressive figures. When people ask you, how much does media save? It's a hard question to ask because you've got reach, you've got audience measures, you've got things like the Bill Bell measures back there. No, but how can you tie that media to behavior? And we're beginning to do that and say when you actually see the hand washing behavior change, or you see the breastfeeding behavior change, then you can begin to tally the numbers, and you begin to say, this is a place I should make my investment.
And of course, social behavior and media kind of go hand in hand because you start spreading the word.
Exactly.
And I know, as Mr. Enso mentioned, about how the partnership with VOA and BBC at some point is about getting out that information. And of course, there must be challenges in terms of getting out that information because I know, Scott, you mentioned the wide realm of information technologies and forums out there. But I want to come to you, Sylvia. You mentioned that, at least in the summary of the book, of the journal, that it is a question of various elements coming together. No one panacea, I think is the word you used. Can you expound on that?
Well, it's a question of, another way of answering your question is, imagine making progress in all these issues without the media. What will happen? Well, we'll not get information, we'll not get sort of attention that is still needed to continue making progress. So it's a way of thinking about, or what will happen if you don't have media attention on this at the global, the national, or the local level, in order to foster the kind of social norm change that underlies many of the behaviors that Elizabeth just described. So it's not just a question of the information, but making certain norms public, sort of changing the perception about what is right. And the media, and we have evidence in this issue, actually showing that it plays an important role, not only in informing people, but actually in sort of validating norm change, in reminding people about these new norms or sort of these new trends that underlie the behavior change that Elizabeth just described.
Marsha, I'm coming back to you, and of course you brought out the key health issue of, I wouldn't call it the century, but definitely for now, which is the Ebola and the reaction to it specifically by the media. As you said, it hurt and helped in some respects. When you put all the information together that has come to be, how effectively could have the media tackled the issue of Ebola to the point where it was more effective in terms of not making people feel they're being talked to, but being talked with, incorporated in terms of, they're part of the solution as opposed to, oh my goodness, they are the problem? Because there was a lot of backlash against the media for that, wasn't there?
I think we have some very good examples of programming that is happening now on radio. And I know USAID has been sponsoring some of the work of BBC Media Action, but they recently have done a set of dramas where they have focused on each of the behaviors that they're trying to promote in West Africa. So safe burial, taking a child to an Ebola treatment unit instead of treating the child at home, that sort of thing. And the programming actually has actors working through the discussion about how someone would make a decision if their child was sick, sort of the drama of the sickness, and then talking about what to do, and then deciding the right thing. Then after the drama plays out on the radio, there's an open question and answer period where people can call in and say, yes, we went through the same experience, or how did you decide that? And there's a back and forth and a kind of engagement of talking with the radio announcer, talking with the SME, the subject matter experts who are on the phone, talking about why that behavior is important. And there's two reasons why I think that's effective. One is that it's a kind of social support and engagement for doing something that's hard. Second of all, it helps to preview a decision that somebody might have to make, as sort of a vicarious rehearsal of the right decision to make and the right action. And then there's a kind of social support that comes from the discussion in the community. And so the difference between writing about the outbreak and stigmatizing the people who are engaged in it through media and talking with people in a radio format, I think those are really very different kinds of media experiences. And I think the radio programming is part of that solution.
It brings me back to you, Scott, how you went back to 1933 when the media environment was obviously very different. Now you've kind of got a real explosion of different ways to access people. Is this hurting or helping? How can it be more effectively directed to, the way the world is now? The communities are so different and they access information differently.
You've got me thinking even further back. James Fenimore Cooper wrote that they say is the monarch of the country. It doesn't matter who says it, as long as they say it and they believe it. And I say that when we think of what the modern day media is doing on what Yudin Dumiyaki called the largest challenge of our time, and I would argue Ebola is not even near. There are more deaths today already from road traffic accidents in this country alone, not to mention globally. Infectious disease, non-communicable diseases, and others on the health side. But it still goes back to the fundamental. Who is they who say it, and what do they believe? And the problem, I believe, and I'll say I'm not a government official, so I say this, shall I say, a public health physician who's got an interest in communication. We didn't do it right. We didn't do it very well with Ebola. They did not get it right. They were not one person. They were so many people that we heard 1 million potential deaths. And I say the CDC was saying that. Today, there are less than 100 that were reported cases in West Africa. We had other groups that didn't know. Misinterpretations. We didn't know who was in charge. We had different spokespeople. A whole variety of issues. I don't want to go into a lot of the specifics because that's not the goal here, and I'm sure many people will write about it, Sylvia and colleagues. But we put together in September, at the same time, and Marcia had the piece with Mario and others, we were at Mass General Hospital coming up with a very simple communication checklist for Ebola, for global health leaders. It's published in the current issue of the Journal of Health Communication. But the very first thing is, establish your objective, have one spokesperson. Also, one place for information. Not it's on a website and it's 100 places. Not changing messages, people, czars, presidents, directors, academics, media figures, hypothesizing things. So anyway, the point is that a lot could be done better. We learn with each outbreak, whatever it might be, that the challenges are there, and we do our best to try to do a better job. And that's the iterative part of communication.
And I want to stay with you still. You were telling me earlier about 20 years into the publication of this journal. How has the changing media environment challenged you?
Interesting. The journal started as a quarterly. We're now 12 issues a year, 500 articles, about 500 we got last year. The issues are in print, but we're starting the Journal of Health Communication, International Perspectives, a second iteration of a journal called Global Health Communication that will be open access because more people get the information over the internet, searching, downloading, and we'd like to get as many people as possible to use the information, and hence Global Health Communication, which is also Silvio's edited book and the work that Elizabeth and others have done and will contribute to the new journal as well. We're very hopeful for it.
And I was also hearing in the news today how mobile phones is really one of the most used form of accessing information. I want to come back to you, Elizabeth, but I want to jump to Scott first because we're still on the issue of communication. No matter what tool, you say that it's really about keeping the message simple,
Right.
effective, targeted.
I think Scott mentioned something that is very important, which is coherent, consistent message, sort of the ABCs of not health communication, but risk communication as well. The problem is if that was difficult, and a decade ago, today is so much more difficult. Not because of the organizational side, not because of the institutional side, but because of this fragmentation of the media. Information travels faster than any attempt in you to manage the message. So managing the message, which has been one of the traditional sort of concerns people do in health communication in government agencies. The problem is, and particularly when you have a situation of heightened risk perception, like an epidemic, like an emergency, information flows so much faster than anything that can be done in order to provide real information, address rumors. That's something that we found in an ongoing project in which we are tracking, we're doing media monitoring on Ebola in West Africa. And we see this consistent reporting of rumors, misinformation, that actually was not done through conventional media, was not done through the social media. Social media is 1% of the population pretty much, or less than that in this country. It was done largely through traditional ways in which information flows and building on mobile telephony and text messaging. The challenge that we have as researchers is capturing that data is very difficult. We can capture data on television, print, online media, but capturing that kind of information, circulating, and how you incorporate that information in messaging when programs extremely much is much more difficult. And that seems to me is sort of one of the main challenges that we're confronting today. How do we listen to what people are saying, particularly in a situation of risk communication, and how we address that in a program? We don't know. The old models work somewhat, because the old model was trying to think about the media as one monolithic actor, as Scott said. That is gone. The question is, how do we sort of rethink the way we incorporated that in a very sort of different, fragmented media landscape around the world?
And this brings me to you, Elizabeth. Obviously, we want tangibles. We also want, as we're talking about media, well, Voice of America, we do media. And it would be good to know, because obviously VOA has a good partnership with USAID, how much of the media relationship with USAID is incorporated in the strategy when you're dealing or addressing issues of HIV and AIDS, polio. Is media a significant part of the plan?
It's a significant part. It's not always called media.
What is it called?
It's-
Is that part of it?
It's part of our problem as a field, and saying, what are you talking about? Are you talking about communication? Are you talking about social norms? Are you talking about behavior? I think increasingly there's a recognition, not just in the health field in USAID, but across the fields. And some of my colleagues are here from, for example, democracy and governance, of the incredible importance of information, communication, media. So it's a very important component of all our programs. We don't always call it the same thing, which is one of the problems of this field. We call things a lot of different things. But starting in, as you said, I think, David, in 1997, we began a partnership with VOA on polio. And that partnership was in many countries, because polio back then was in many countries. And
now
it was
it's down to literally a handful.
It's down to three or four. And at that time, you had people here in your language services who'd actually worked in countries, and in some cases were polio survivors. And they had an amazing connection with the communities in their countries. And that's kind of the point I want to make on where we're going with media, that I think it is very important what Silvio says in terms of getting the information, getting the rumors straight. but it's connecting to the communities. And I think that's where the local languages, the attention on culture, and the ability of this fragmented media market to also kind of flip it and say you've also got something good there, because you've got things that are very, very close to the communities themselves. And so you're able to work much more almost on an interpersonal communication level using a lot of different sources. So we at USAID continue across our programs to work with information, communication, culture, and media. We work in girls' education, we work in journalist training, working in Pakistan. I was asking for example, and working just on gender issues, and working very much with rural women's associations. And we partner, and I want to just, one truth in advertising, the work with BBC Media Action was actually not ours, it was the Paul Allen Foundation. I wish I had that kind of money. No? I wish I had that, but that's,
Thanks
you know.
for the confession.
Yeah, it's a confession. But we do partner across a lot of our fields, and I think one of the beauties of a gathering like this is that we begin to speak the same language.
And of course, that's one of Voice of America's strengths, 45 languages. I work for the Zimbabwe service. We have, 3 languages already, and it targets the people who are the ones who, I guess, are the ones who are tasked with making that change. So the conversation on this end can go on all evening, but I really want to bring in some of the audience. So if we could start having some of the audience members come up to the microphone. And I'm looking for Rakwa. Is she with us? Well, she asked a question, which I can read on her behalf. Oh, there you are. Do you mind coming up to the mic?
Anybody who wants to ask questions, please, microphone is here for you.
Mm-hmm. And again, also remember that we are streaming live. #help. #media4help. #media4help. So as we're waiting for Rakwa, oh, she's here. Okay, please go ahead.
Good evening, everybody. I'm Rukia Haider, Chief of Bangla Service. And I'm running the USAID-funded communication sales project in Bangladesh, which I believe reaches millions of people. And Bangladesh, a country of more than 162 million people, half of them women, who are our key audience. Unfortunately, as we know, going there often and on, then they don't have easy access to radio, TV, or cell phones. But they are our main audience. Has there been any survey done which suggests which is the best way to reach these women, these people, half of the Bangladesh population? Thank you.
Anyone willing to take that question?
Thank you. It's a huge question. And Bangladesh is a very special country in that regard, because it's also a country that has an enormous penetration of cell phones. And one of the programs and cell phones that women have access to, which is also an issue. One of the programs that we're working with in Bangladesh in terms of reaching women is through SMS services through cell phone on health messages. And there are a lot of people are using cell phones. A lot of people are using them for health. There is very little research on is this actually working. So we've also commissioned a study that is actually going to look at impact on behavior and eventually on mortality, maternal mortality in terms of care seeking and child mortality. It's a program called MAMA that reaches now a large percentage of the population in Bangladesh, the women. But it's different by country, and some of my colleagues here who work in gender will say, obviously, there are countries where women aren't given access to a cell phone, or they have a cell phone in the house but they can't use it, or they can't turn the radio on. So it has to be very much contextual.
Thank you.
If I can follow on to what Elizabeth just mentioned, MAMA, the Mobile Alliance for Maternal Action, came together as a public-private partnership, and I think what's quite interesting and something to consider why cell phones can make a large difference. We talk about a lot of this other mediated reality, shall we say, by journalists, but if you think of a cell phone and an SMS message or a audio message that could be scripted, You have a scripted entertainment format of good, valid, viable health information.
Yes,
You
so
also-
that they can understand.
That they can
It has to
understand.
be their language.
That their language, culturally linguistic, ability to pass along, repeat. You will theoretically, right? We, as Elizabeth said, we don't have all the evidence yet, but it does begin to show that there's a lot of promise, and that is both a medium and a message.
Thank you.
I think it's a question of trying to be sensitive to how people communicate, how people talk about health, what do they believe, what kind of media they use, and that gives you a sense of how to organize media program. What the fragmentation of the media does is provides you this unique opportunity to tailor not just the messages, but the way where we find people, where do people talk. And that is much more complex, but it's much more sort of, I remember the days in which we used to think about sort of single mass messaging for entire population. All that is gone. All that is gone. So it is a great opportunity to understand better where the people talk about the kinds of issues that matter and who they believe. And that's something that we need more evidence of this. I mean, a mobile telephone we have evidence about in terms of strengthening health systems or facilitating health workers, sharing information, all that. But it seems to me that it's a great opportunity to know more about how to use these new forms of communication and how to sort of plug the traditional media into those networks.
Thank you. Do we have another question? And as we're waiting for somebody to come to the mic, maybe you can explain about that. Is there somebody? Okay.
Hi, good evening. I'm Kate Pound-Dawson. I'm the foreign editor for the Central Newsroom here at VOA. And as the new caseload numbers start to decline in West Africa for Ebola, the question for me is, what do you suggest is Ebola it's fallen off the front pages, it's no longer the big, we don't have breathless headlines on CNN these days. What do you suggest is the angle that journalists who are trying to communicate with communities in Africa, what are the angles we should be looking at to bring that serious, helpful information to these communities about this disease and about other health issues, but particularly about Ebola? What can we bring to them that's helpful, constructive? What angles?
I like to use the analogy of disease surveillance. Just as we are talking about the need to strengthen disease surveillance in many countries around the world and to strengthen health systems, it is important to strengthen communication surveillance, what I would call it, come up with a better way to call that. But it's a way of keeping an ear in terms of what's going on, what we are talking about in terms of diseases, and particularly around Ebola. Once the cameras are gone and we know that the attention fluctuates according to a number of sort of variables, how is it that we can keep covering the story locally, regionally, and globally, even though some of the key elements, the risk perception or some of the more sensationalist elements are no longer there? That to me is the next challenge, how to keep a story going even though it doesn't have some of the conventional elements that typically drive sort of public opinion attention or media attention. Because the issue is going to stay and it's going to come back. So the question is how communication can be part of the lessons that we learn in terms of strengthening sort of our collective global sort of attention on those issues.
Also, maybe you could also weigh in on that as the CDC, obviously, what comes to mind for me is HIV/AIDS infection rates and how some say, the issue of Ebola and some of the more current issues have literally usurped that conversation. Do you have any thoughts on that?
I think that there is a commonality across, and it is building local capacity and integrating our efforts in those areas with the consortia that are trying to pull together a lot of different kinds of media, along with healthcare organizations, in order for this to be local and owned locally and disseminated locally. I think the issue comes when there are multiple voices saying different things. We've talked about consistency of messaging. So we go in and out, but their local capacity stays. So anything we can do in this process to help build and train, build systems, train radio stations, train journalists in order to communicate in ways that support health. I think that's where we need to be going, as opposed to thinking about sort of parachuting in and parachuting out with our press activities.
May I ask a quick follow-up? Going back to the surveillance issue, with SARS and also with the avian flu that was originally identified in 1997 in Hong Kong and China, southern China. I was there when both of those broke out in southern China. We had the advantage in that, particularly with the avian flu, that was easily identified in flocks of birds, and they were identifying it quickly in the bird populations. Does it complicate surveillance and early detection of outbreaks in that we're not seeing Ebola in an animal population first? Does that complicate things for us? That we don't know that vector?
We actually do know some of the vectors. And they have identified the index case in Ebola with bat. But I think we don't see it. We don't see it first. We don't see dead animals first. Yeah. But I think it's sort of taking your point one step further. The whole question of surveillance, but more sort of on a positive way, sort of global health security, one health. Like the health of animals and the health of people are very related. Yeah. We eat them, we live with them, we buy them, we sell them, that kind of stuff. And I think you must have seen this in China. The incredible growth of the poultry industry. Right. So one of the things I think that's coming out of the whole Ebola experience has been an acute awareness of global health security and a One Health model. And I think that's a media story that's important because it goes, from the global level, we're all part of this, to a very local level, to look at things like eating bushmeat, or some of the hunting stories and things like that. So it's the awareness that health has now become a very large security issue.
Great, thank you.
And I'll just take the final piece of that to say that health strengthening and health systems are not only in the health care delivery system. And more of this by integrating the same sort of education and behavior change components early on. How do you change, burial practices? How has the world already started to change in terms of HIV and male circumcision? How has the world begun to change in some of the other human rights areas? So the more you bring all the pieces together, the more I think you'll be able to help make a difference. And by no means, just because the numbers are down, we want to try to get that as close to zero as possible. I mean, Ebola's been around for decades. It should not have come back and spike back as it did.
Hi, it's Joan Maurer, and I helped organize the panel, so I get to ask a question. My question actually has to do with the criticisms that Lori Garrett and others have raised about how money and aid can sometimes distort the health systems of local communities, and in particular her criticisms of the HIV funding, which of course were billions of dollars and have had quite an impact on Africa. But what has been the countervailing effect? Have we basically focused so heavily on HIV that everything else has sort of gone out the window? And anyway, just on the criticism of how we allocate our resources, and do resources, if poured into countries, actually harm those countries in some ways?
Anyone?
Yeah, let me take a stab at this. I think on the upside, we see where taking advantage of funding when and where it comes and building systems that can serve more broadly than the specific disease for which the dollars were allocated. I think there's no doubt, we look at the Haiti earthquake, we look at the cholera epidemic that followed close on, all of the PEPFAR platforms that were funded in Haiti became very important for surveillance, very important for delivery of care. And I'm not sure what we would have done in Haiti had it not been for those platforms. And I think you can see the same thing in Nigeria around Ebola, that in Nigeria we had funding to do other things, and in particular had funded through HIV some training of healthcare provider or healthcare epidemiologists. And when Ebola struck there, that structure was ready. That funding hadn't come for Ebola, it came for something else, but it was used to support other things. So there may indeed be distortions, but if we are wise, I think we can leverage those dollars for the future.
Thank you.
My name is Marvelous Muslanga Nyahuye. I'm with the Zimbabwe Service. And my question is specifically for USAID. We had a very good relationship with USAID, and I host a women's program called the Women's Forum, where we basically are trying to educate the women on health issues. But because we've been following on the traditional diseases like HIV and AIDS, the ones that we've had for a long time, Ebola has come in and taken up most of the funding. How do we ensure that we still educate the women on the traditional, diseases without having to worry about where the funding is coming from?
When you've got appropriated funding, you do have to look at where it's coming from. And in terms of the way our programs work, funding is appropriated for different disease areas or health areas. That's an act of Congress. Ebola has had a huge upsurge in funding. But I think going to Marsha's point, the sort of the answer to that and what we've seen in terms of working as health professionals across different funding streams is to try to build those platforms so that you have the platform there, you're reaching the audience. And basically a lot of these behaviors are behaviors that you're going to, hand washing, breastfeeding, basic sanitation and wash. These are behaviors that go across health areas. And so there's no reason why you can't use funding from one of those because it touches on the same behaviors. And if you're reaching women, it's the role of women as health providers in their families and health seekers. So I think you're also looking at some of the normative and cultural shifts around women's ability to do that and to take power in some of those health areas. So I think it's looking more broadly and being more opportunistic in a way to use different funding streams to build those platforms both across health but then also across the woman herself. No?
But how do we then attract funding that's now going to Ebola? Because we are stuck with the traditional diseases that women are facing day to day. But most of the funding has now been,
The funding for Ebola is additional add-on funding. It is not, it's supplemental. So the other funding was not, did not take from the other funding.
Thank you.
Good afternoon, Willow Pequanot. Some politicians said that you're entitled to your own opinion, but not your own facts. And Scott, even if Frieden and Fauci got together and put out the same set of facts, I think there's a dynamic tension between health communication and what you should do versus the what we can call big media, which is trying to build readership and following. And so they're going to take those facts and massage them and maybe not exactly lie, but distort them in such a way. And people tend to go to the media or the outlet that is lines up with their values and so forth. So how can we develop a more national health communication message and way to reach people that we can have good social diffusion and neighbors can give messages to neighbors that are factually correct, and we can change behaviors and people will know what they can do to prevent disease?
Well, thanks, Paul. That's a very good question, and notwithstanding people's belief that the media is only there to sell papers, it's also to build brands. It's also not only sell papers anymore, right here, all the electronic pieces that are there. I think that there is a possibility in all this, and ironically, I'd written something about 6 months before, a year before the pandemic, if you want to call that, or epidemic, or breakout of epidemic proportions, if you want to call that, for Ebola, depending on what you want to call it, of what we need to do to prepare for it. And notwithstanding what happens at NIH or CDC or USAID or governors of states or town health commissioners, all these people can decide in different ways on everything from quarantines to quasi-quarantines to low risk, no risk, some risk, a lot of risk, and there's a problem. So I think there is a possibility, what I was calling for, and I still believe I think it can be done, whether it's at a multilateral or whatever area, but what are ways to define what those areas of risks are, create a quasi-health information bureau or something of that nature that then a credible source can refer back to. So we're not continuing to put out information that's at crossroads and then someone on TV that has a large following, and I won't say what network nor his name, but he was talking about the aerosolization of the Ebola virus when it comes off a plane here in the United States. And what does that mean? That's sensationalism at its best, the last. But if we did our best to try to get the message right and straight with source credibility, which goes back to what Marcia and Sylvia and all of us who are trained in communication, basic Aristotelian rhetoric, source credibility and integrity, #1 importance. That's what we need to continue to build upon. I think it can be done. I think it can be done with work of USAID, VOA, the whole governor's group, but it has to be consistent, it has to be credible, and it has to be something that people can use and act upon and get deeper information if they are interested in that information. So I think it's possible. I haven't seen it done yet. I mean, I can give you names from the last we talked about avian and SARS, swine conflusion. We come up with all these different names of what went wrong. I mean, when the Institute of Medicine looked back at SARS, Harvey Feinberg said the problem was not the science, but it was the way it was communicated. Each time it continues. So anyway, it's I'm hopeful.
I think, just to add something that coming out of recent research, not just health communication, but communication in general, which is it's not enough to have the facts because of selective perception, which is people sort of choose what they want to be exposed to, and confirmation bias, which people interpret what confirms what they already believe. So just to have the facts, it doesn't mean that people will change their mind or will do something differently. So the question is how you establish a conversation rather than just, quote unquote, disseminating the facts in ways that resonates with what people actually value. And that's sort of what I think what I was trying to get at earlier, which is understand what people are concerned with, rather than just the more traditional way, well, if we have the right facts, we spread the facts, then marvelous things will happen. And that sort of, it's partially right, but it's not completely right, because it ignores all kinds of noise and misperception that do happen, even when the facts are made public.
Thank you. We have another question.
Hi, I'm Deborah Mesh from Population Reference Bureau, and we do media work, we do with USAID work as well. Our audience is a little bit different from what's being spoken about here. Here we're talking about using the media to reach the masses. Our work is focused on reaching policymakers. Do you have thoughts on how different that is? How do you change those behaviors?
I'm sure Marcia and Elizabeth, those are questions that you'd love to address.
It's, I think some of the work that you yourself are doing, and it's a way of marshaling facts for policymakers and putting data together in different ways to show things. The things that Population Reference Bureau does with the population fact sheet, and some of the work in terms of really creatively using data and communicating to policymakers. So you can say, actually, if you put money here, this is probably what's going to happen, and if you don't do this, this is what's going to happen. So I think partly it's creative use of data. It's getting reliable sources. You're not going to hear things that are told from people you don't agree with, especially if you're a policymaker. So it's who's the voice. But I find increasingly in the government that we are becoming so data-driven, and we're swimming in it. But if we can present it graphically and present it in a lively way that makes a point, you can change some of the policymakers' minds.
On that issue of policy, while we're waiting for the next question, of course, you have come across some of the criticism against the impact of policy on funding. Obviously, when it comes to certain countries that maybe are not that friendly to the U.S. or the givers, is a question of, do you disperse funds? Of course, one country that comes to mind, obviously Zimbabwe. I know you probably reflect during either to do with the PEPFAR. How do countries get allocated? How are those decisions made? Is policy a factor in terms of that? Can you speak to that?
So CDC has about 60 country offices, and the programs in those offices vary from influenza to HIV to global disease detection, and a long range of those, big range of different programs. And I think it really is a policy question to say, where do we work and why are we working there? And politicians, of course, are very interested in what are the advantages for the U.S. in working in that. Does that serve a global health security purpose that helps keep the United States and travelers from the United States safe? Does this help stability in the area? A country that is awash in disease is not a stable government, and that is also an issue for the United States. So some of those issues of why are we there, doing the right thing is a very important part of that, but also asking the question of why are we there that's of interest to the American people. And I think that's one of the big ways to communicate with policymakers about where allocations go and how we use them. Next.
Lynette Golding with the Futures Group. We've talked a lot today about Ebola and some of these big scary things, anthrax, SARS, whatnot. Are there health topics, I don't know, like essential nutrition actions, IFA for women, you know, some of these more kind of mundane and boring topics that can really be, that mass media can actually help, you know, pick up and other than like say on Grey's Anatomy or something like that, right? How do you get things like women taking IFA during pregnancy? How do you get that in the media? Because it's not big and scary like anthrax or something like that. How does that work?
How does it get in your journal, Scott?
It's not mundane yet, and this changed. There used to be a lot of tobacco control when there was funding tobacco control activities, a lot more HIV earlier on, frankly. Well, let me give you a topic. What's the number one cause of death that was in last year's adolescent health report, WHO adolescent health? Car accidents, road traffic accidents. Well, how many people really know about that? And when you take road traffic accidents, age 15 to 29-year-olds, it's the number one cause of death. So you have almost a whole group of millennials, that some of whom will have very little experience. And there's a whole variety of issues. You know, we've been mentioning this as the great savior for public health. This is a health hazard. This is a hazard for drivers. Alcohol is a hazard for drivers. Speed is a hazard. Roads that are not constructed. People not wearing helmets. Pedestrian. All this. And where is the kind of emphasis that's there? So sometimes what happens is you have broad groups that, you know, make proclamations, but how the world follows is different. Now, you know, I mentioned, you know, I'm not in the public sector, so maybe I can speak a little differently. I work in the private sector now, and we've got a new coalition together called Together for Safer Roads, so I know a lot of these numbers, but it's disproportionately affecting the developing world. As you have urbanization, we're continuing to see the environmental effects also. So there's lots that can be done. How do you get people to hear about it? The same question that we had before about policymakers. How many people know about it? So as a private citizen, we have more of an opportunity, frankly, than agencies to, quote, lobby, right? I mean, I happen to serve on the board of scientific counselors for the CDC on infectious disease. So we've talked a little bit about how can you continue to get the world to pay attention to the simple things that Elizabeth mentioned. Hand washing. So remember the numbers? Millions of people can be saved by some simple behaviors. But if we go even broader, how do we do that for local communities? How do we get to our members of Congress, not just when they're up here, to talk about tuberculosis, to talk about some of the ongoing pieces that often lose the emphasis that they need to be. The PRB pieces are great. I think the piece that Elizabeth mentioned, data-driven and the infographic ideas, it's so key to be able to have a picture that has both numbers and tells a story. So we need new ways. So I don't know if that answers it. I'm using road safety as an example, but all the other ones, sure, you can try to create storylines and you can script those, and those are important. But you need ongoing emphasis and data-driven goals.
It's kind of the analogy we use in news. If it bleeds, it leads. And so it shouldn't apply to health as well. I guess it's a question of how do you stay proactive. Do we have yes?
Yeah, I have a brief information question as well. My name is Solomon. I'm a broadcaster with the Horn of Africa service here at Voice of America. Right now in Addis Ababa, excuse me, right now in Addis Ababa, the capital of Ethiopia, it is at the Horn of Africa, it is about 2 a.m. And it is good to know that the Minister of Health of Ethiopia is watching now this forum. And he's just tweeting, he just, posted a message now. And that is really encouraging. And what I want to ask about is Ethiopia is one of, according to CDC, USAID, and WHO, one of health success stories in Africa. So what do you do to help others to share that experience at media level? I participated in the fight against AIDS in Ethiopia, and after we managed to galvanize the media and media professionals in the country, we managed to avert the stigma problem in the country, and afterwards, Ethiopia, is a success story along that line. This is one question. Do you take others to Ethiopia so that they share the problem, and do you learn the situation right there in Ethiopia? The other thing is, I would like to know your attitude towards the media. That is, when do you consider the media in your planning process? At the beginning, in the middle, or somewhere when you feel that you have some extra funds to include the media? Thank you.
Well, thank you, Mr. Minister. We're very pleased you're watching. Ethiopia has a success story in HIV/AIDS. It also, and I think this is the point, it has an amazing success story with malaria. And I think that's a question where we can see how media has worked successfully with community health workers. And the community health workers in Ethiopia, there are now, 45,000 of them. So it's the combination of using mass media and information and then having the personal contact of the community health worker right there to distribute bed nets and teach women how to hang nets. And that, I think, has been one of the success stories in terms of malaria for Ethiopia. So I think that there's questions of how countries also learn from each other and teach each other. And that's, I think, one of the really wonderful things that's happened around the goal of ending preventable child and maternal deaths. And Ethiopia partnered with us 2 years ago and then again last year on acting on the call to end preventable child and maternal deaths, and co-sponsored the meeting with UNICEF and USAID. And there, what we found, it's not talking to ministers and telling them things they don't know. It's putting 24 or 30 countries together and having the ministers sit around a table and share these stories and communicate what's the success and what are the elements of success.
Thank you, Masha. And I think one of the successes in Ethiopia is a great example of maybe an answer to the question that came before of how do we deal with sort of the routine things, the chronic things that aren't as alarming and so don't draw as much funding. One of the things that CDC has done with partners in Ethiopia has been to institute cervical cancer screening at the same time that HIV gynecological services are being offered to women in that country. And so if you're already providing that service, why not take the extra step of doing the cervical cancer screening? You're already in process. It costs very little, it saves many lives, and it provides a service that in itself might not have drawn a lot of attention and support, but it's an easy step when you're already providing a similar service. And so that's been a real success story, I think, in Ethiopia as well. And it also provides kind of an analogy about how some of these other services can be linked in a very inexpensive and simple way to higher visibility services.
Thank you. We have another question.
Yes, Bill from BBG. We heard earlier about the potentially pernicious effect of social media in spreading misinformation about health issues and disease. I'm wondering if any of the panelists are aware of the reverse, of any positive usage, deliberate usage of social media to promote beneficial information or behavior change in the health sector.
I think there are two risks when we're thinking about internet and the social media in particular. One risk is to exaggerate the importance, and the other risk is to minimize its importance. The first one is exaggerate because we live in the world in which internet access and social media are typical. So we tend to think that there should be an app for that, that meaning whatever problem we're trying to tackle. But we typically forget that 2/3 of the world don't have access to the internet. And then when people have access to mobile telephony, it doesn't mean that they have quote-unquote smartphones or that they regularly use it for accessing social media feeds the way many people do in large urban centers in the West, parts of Asia, etc. So the problem is to believe that social media is the problem. I mean, it is part of the solution. The flip side of this is to assume that it doesn't matter. It matters because it reaches certain people, journalists, policymakers, opinion makers, in which sort of the social media does matter in setting the agenda for what actually they cover or they believe it is important or where the conversation is. So here's where we have to be strategic, meaning is social media the best way to reach the kind of audience in order to bring awareness or reinforce certain messages? And I think that there answers your question, meaning that we have evidence in which basically there is no direct correlation. Studies done in which what goes on Twitter in some ways is reflected in what news organizations cover that day or the following day, right? That Twitter is becoming, if we can consider Twitter as sort of one single platform, which is not, because you kind of pace Twitter the way that you want, that in some way it is an agenda-setting platform for the news media. So there you have evidence that actually it does matter. It doesn't matter to achieve other things, or we don't have the evidence that actually reaches people in certain ways to convey certain messages. So I think that, I think it's time to think differently about the way we think about social media and internet. It's not the solution, but sometimes it's very sort of helpful in order to achieve certain communication goals.
Do we have any more questions? We are on, please.
Yes, good evening. My name is Lionel Gahima. I'm part of the French to Africa service. I'm a producer for the service. One of my colleagues, Khalil Gay, who's not here, has extensively reported on some of the health issues like AIDS, and recently he did also some extensive reporting on fistula, which is, I'm not saying it's a disease, but it's something that probably a lot of people don't talk about because of exactly the behavior that, that disease causes in the community. Is there any quantifiable data or information that you know that you may share with us, maybe how the media has probably played a role in terms of bringing that to the population at large so they can learn about what is going on about this very, very, destructive health problem? Thank you.
Anyone like to take that question?
USAID has an important program on fistula repair and in some cases prevention. Fistula is caused by obstructed labor, in some cases by rape, by a very young woman having a pregnancy very early. And we certainly have done and worked with local communities because it's as you say, it's an incredibly stigmatizing condition. basically a woman becomes incontinent and is thrown out by her community, by her family. And so the work that we're helping to support, and it's working very much with the communities and with the health systems in countries where this is a problem. And we don't have strong numbers on how big the problem is because it's so stigmatized. In the millions, probably. But I think the type of coverage that's happened in this country on fistula, Christoph certainly has made that a topic. And I think getting the information out on it through local media in terms of not stigmatizing first someone with fistula, but then also after repair, the reintegration, which is a very painful process for a woman who's been thrown out by her family and her community. So it's a huge opportunity. I will get to you if you could tell me your email. I can send you descriptions of what the programs are doing. We've just made a new award for fistula working with our family planning colleagues.
So,
yeah?
I'll just jump in. In Nigeria, we
Yeah.
have a fistula care, I forget the exact
Yeah.
name of the implementer, but they've had very good luck talking to Nigerian state radio and state television. You know, that coverage is provided free of charge by, I think, by Nigerian local media.
Now we've done specific shows in our weekly television show, Washington Forum, about the subject matter. So we kind of play our little role into just bringing that to the mass.
Well, thank you so much to everyone. Very interesting questions and really great insight from our panelists. And before we go, I'd like to just get 2 more seconds of your time if I just have you all saying to us as media and as supporters of media, onlookers of media, where do we go from here, from today? How does anything change between media and the impact it's supposed to make?
First thing is like following the question about when do you plan media? Well, plan it early and often. That will say. And plan it throughout the process. Monitor and evaluate media and communication activities. Don't think about media. Media is not communication, not an afterthought. It's not something that happens when you have an emergency or when you have a PR crisis. Media communication should be intrinsic to the way we conceive programs rather than just an add-on because we need to put out information about what we're doing. That will be sort of what to do next. I mean, and we already have been sort of shifting the way that we conceive programmatically media and communication. We are on the right track, and I think much work needs to be done advocating with people who manage programs, people who fund programs, to think about the media and communication as intrinsic components of the program rather than something that, let's put some money there just in case we have a crisis or because we need good news for the program. It's completely different the way we need to conceptualize it.
Thank you so much. Elizabeth, I think that speaks to you also, so that means you cannot cut funding for us, right?
Not cut funding.
Okay, in 2 seconds. Where do we
Yeah,
go from
3
here?
things. Going forward, use data. Data's out there, use it. Look at behaviors. Focus on the behaviors themselves. It's not general stuff sometimes. And I don't have to tell this to VOA. Remember context. How many have language services? 47, 40, 45? Yeah, remember context. It matters.
Thank you so much. Scott?
I think we ought to all consider our role in society. That we're not only creators of information, we're consumers of information. And also the information and the media challenges that we have with new technologies will also create new opportunities that we can't even think of, such as the data of crowdsourcing. So the question of, how is social media or new technologies making a difference? Imagine this surveillance mechanism if we start to figure out ways to get the information on early warning systems and so forth. I think also as we consume and create, we also continue to have an ethical element that's multi-sectoral and multi-channel. So the obstetric fistula case, how do you tie that into the maternal health goals of the UN and Millennium Development and Sustainable Development Goals? How do you then communicate with policymakers, so bring women in where you don't know of obstetric fistula in the United States, but it exists unfortunately in many places around the world where it's, as we talked about other issues. So think that media is not only the technology, but media is also still telling the story through the personal experience to the policymakers at the right time when they can help make a decision, tying to larger global health goals. I'm still optimistic, so I'm going to keep it that way.
Thank you so much. Marsha, your last point, please.
I think we need to think about media as multiple layers, and that the notion that we're going to go straight from an agency to the public through media it is much more complex than that now. There's much more nuance to it. So just to end with Ebola, consortia are sending messages through Facebook and to newspapers, not because they think the people they're trying to reach are reading those newspapers or accessing that Facebook. They don't have that connectivity, they don't have access. But the people who do read those, the radio show hosts, are taking those pieces and then using them as stories on radio that does reach people. And so thinking about how do we use all the media that we have in order to get to the audiences who can bring the information to the people who need it.
Well, on that note, I'd like to say thank you so much, Mr. Scott Ratson, Ms. Elizabeth Fox, Mr. Scott Ratson, Sylvia Wiseborn, I'm sorry, and Dr. Marsha Vanderford. Really great insight. And I want to thank everyone in the audience. Thank you so much. Oh, yes. So first, of course, I'd also like to thank the office that organized this, and I'll name specifically Joan Mauer and Ina Davinsky. And there is a reception, so please do not go away. Let's all mingle. And the book is out there, so anyone who wants a copy, please help yourselves. Thank you so much.
Thank you, Debbie.